It's Charter California Edition. I'm Brad Pomerance. He is back, our friend Don Knabe, member of the Board of Supervisors in Los Angeles County. And so there is no doubt that this county is getting ready for the Affordable Care Act. Whether you support it or you don't, it doesn't matter. It's here. We know that in California, one can sign up for an exchange from October 1st to March 31st. There's the Medicaid expansion, which we can talk about in the next 10 minutes. How is Los Angeles County getting ready, the second largest public health system in the country?
Well, let's begin. I mean, you hit it right in the head. Whether we were for or against, we have to be ready. And there's some good things and some bad things.
Of course.
But the biggest thing is the unknowns. For us, in that 2,500 pages, which very few people read, and I think 2 people in the county have read it.
Exactly.
So we're trying to wade through it. So we don't know what a lot of the financial impacts are. You've heard me talk before about the immigration reform and a potential perfect storm. But what we're trying to do, electronic medical records, creating medical homes, getting more of the clinic-based instead of emergency room-based. And so the biggest thing that I think people misunderstand about it is everybody thinks everyone's going to be insured. There's going to be a lot more opportunity for people to be insured. So that gives us 2 problems. One, we need to be able to keep some of those in our system, because if they have a choice between us or Cedars or Long Beach Memorial or some of the other hospitals in there, what are they going to pick?
Number two, do you want to, when you say you want to keep them in our system, we need the county
because
system?
the new people that have the ability to have insurance, we want them to be paying us. And we
as
want
a provider.
As a provider. So we
so
now,
you mean, like
this
County
is a total,
USC?
yeah, this is a total cultural change. We have to be a competitor now.
How interesting.
We are no longer just, we can't just look at ourselves as serving the poor as the ultimate safety net. But part of that, even, as you've heard me say before, 2.6 million uninsured, largest uninsured population in America, there's still going to be close to 1 million uninsured folks in Los Angeles County
and
after all is said and done on the Affordable Care Act.
Is that because they don't sign up for Covered California, and or they don't sign up for the Medicaid exchange, and or they're not qualified for the Medicaid exchange, or because they're undocumented?
Or because they're undocumented, or because they don't sign up, or they don't qualify.
I do want to talk about the undocumented, because whether you support the Affordable Care Act or not is irrelevant. What we do know is the undocumented are not covered by the Affordable Care Act. They cannot access.
And that's when I talk about the perfect storm. There's a rush to judgment in Washington right now. Well, there used to be a rush. I'm not sure anything's happening there right now. But as they talk about immigration reform and the 15-year path to citizenship, they say there's no net cost to the federal government. Well, the reason for that is that 15 years, local government, vis-a-vis counties, who are the safety nets, have to pay for that health care. That could be huge, because people will come forward because they now know that they can, on this path to citizenship, so they're not worried about getting thrown out of the country or whatever. And this happened before in the 80s and 90s when we went through the other immigration reform, where people came out of the woodwork and our caseloads went through the roof.
See, here's my question, and I'm not taking a position by any way, stretch, or form, or whatever cliche I want to use. Diseases don't know whether you're documented or undocumented. Communicable diseases don't know whether you're documented or undocumented. So if all of a sudden we get a communicable disease in the undocumented population, they can't get health care because they're uninsured, who loses?
They do get it. That's where the issue is. They do get it come to our system.
Right, but that being said, they come to the system late because they don't feel as if they can access the care. And by that point, they're already incredibly contagious. And so
that's the way it sits right now. With the immigration reform and the path to citizenship, they'll probably come sooner, which increases our caseload, but no reimbursement from the federal government. So the point being is that in this path to citizenship, the federal government has to step up. I support a path to citizenship. I don't have a problem with that. What I'm saying is, don't drag us out 15 years with no repayment of anything.
Under the immigration reform plan passed by the U.S. Senate, we have no idea what will happen to it in the House, if anything. Does it address health care for the undocumented?
Yeah, 15 years from now.
15 years from now. And so where does that leave the counties? You've said it.
The counties are left holding the bag. The counties are left by providing the service, which our caseloads, as I said, will go up because the undocumented that now stay away until they're really sick will start accessing the system earlier because they're not going to have to face any immigration issues.
It's fair to say that the likelihood we will see immigration reform is dimming by the moment. We don't.
Yeah, but that's a sidebar. I mean, it's a perfect storm. You're absolutely right. The Affordable Care Act on its own is going to cause enough issues. I'm just saying there's a potential perfect storm if they do something.
Let's talk about the expansion, because you have said we're going to see a lot more people on that are accessing health care. But what that means is that these folks are coming in. Do we have the primary care physicians to handle these new folks coming in? Are we able to convince them to come to primary care and not go to an ER? Because that's where the economies of scale hit, is if they enter the system in the primary case and not go to an ER with a severe flu.
Well, I think that's the most important piece of this, if we need to be able to create medical homes. The other big issue coming January 2014 is the relationship between the patient and their doctor.
Right.
We don't know what the doctors are going to do. The doctors are very concerned about the reimbursement schedule, and they may start creating their own new IPOs. So they're all in this mix. And so having enough physicians, or do they just retire, or what do they do? I mean, they can't move to another state because everybody's on the Affordable Care Act. So those are the technical details that I think potentially have not only impact on the patient, but an impact on the counties as we try to prepare for this. We may find physicians that maybe come to the counties, versus having an independent authority of their own. So those are things that need to be determined or will be determined.
What is the county doing as an employer? Don't you have 100,000 employees in the county?
Yeah, 100,000.
So what is the county doing as an employer? Are you just staying as is? You don't need to access the exchanges? I mean, you may not know, and I don't expect.
Well, we don't know whether or not some of these folks will have, whether depending on their pay scale, whether they have. But we have all kinds of insurance. We have a labor management group. I mean, we have your preferred choices, Kaiser, whatever it may be, or you can come to our own system if you want.
Right.
So from that standpoint, I think we're a little bit better off than the average consumer.
Right. So I guess when I think about the county, what really impacts the county more than anything is the Medicaid expansion.
Yes.
Is that fair?
That's fair.
And so are you prepared for the Medicaid expansion?
Absolutely. I mean, that's what we're trying to do, particularly as we're trying to create the medical homes, as we try to create electronic medical records, so the transfer, we're not duplicating services. We're trying to be as efficient as we possibly can to be prepared for the increased caseload that we get, also understanding that we may wind up with all non-paying customers. The best thing about the Affordable Care Act for the County of Los Angeles is that we have to change our culture. We have to realize that we are now a competitor. When we have all these uninsured people coming through, and again, many of the uninsured, we've talked about this before, are coming through because it's by choice. They're betting on the come. They don't want to pay $700 a month. Some of these exchange prices are very expensive too. So when you get that kind of a patient load, all right, all of a sudden they become eligible, and some of them will be able to afford insurance. We want them to stay in our system. And so we have to do this.
That takes education.
That takes education. That takes a piece where we say, look, we're going to create centers of excellence. Right. We can't be all things to all people anymore. And maybe this hospital does this and this hospital.
So we know Cover California is engaging in an advertising campaign. I think it's $90 million to get the word out about exchanges. Will the county be engaging in an advertising campaign?
Yeah, absolutely. We're going to be having a marketing program. We're going to let our current patients know and what's going on and try to make them a partner with us as we go forward. So when they come to a county facility, they say, look, all of a sudden they're getting something in the mail that says they can sign up.
Right.
We want them to sign up with us.
What about on the Medicaid expansion? Because like you said, the county wants those individuals to sign up for Medicaid expansion. It's to the advantage of the county, but there's no camp. I mean, Cover California is not going to use that.
No, but I mean, the point being is that they become a patient and they become the ability,
How do we convince the people to sign up for Medicaid expansion? That's my big question. How do we get them to sign that form? They may not even realize that they can sign up.
No, but that's part of our educational process that we have to be a competitor in. I will tell you, the exchange and all the other medical facilities are going to be in that mix. So we have to be right in the middle of that mix as well, too, because all of a sudden they didn't know, but they're going to need to know the fact that they're eligible for that Medicaid expansion program. So it's marketing for us, too. So that's the good piece of all this. So we just can't sit there and say, you know what? We're a safety net, sir. Our job is to take care of the poor.
Not anymore.
Not anymore.
His name is Don Knabe. He is a member of the Board of Supervisors in Los Angeles County. When we come back, we're going to speak with Tom Salerno. He is the president and CEO of St. Mary's Medical Center in Long Beach, California. We'll get his take on how the Affordable Care Act impacts hospitals. I'm Brad Pomerance. We'll be right back on Charter California Edition. It's California Edition. I'm Brad Pomerance. Our guest, Tom Salerno, he is the president and CEO of St. Mary's Medical Center in Long Beach. That institution is part of the Dignity Health System, which is the largest hospital system in California, 5th largest in the country. So no doubt you are on the front line in terms of the Affordable Care Act and the reforms that are coming down the pike. As a hospital administrator, what are you doing to prepare?
Well, one of the things that we're doing and other hospitals are doing is we're really looking at how we bring care to the residents of Long Beach.
Right.
And that is done through a number of ways. We have a mobile health clinic that we actually use to bring primary care to residents of Long Beach. We also have...
Let me ask you if I may. I
Sure.
know there's a lot of great things you're doing, but you mentioned primary care. And we know that one of the goals of the Affordable Care Act is to move people to primary care physicians as opposed to emergency room physicians being their first line of attack.
Right.
The challenge of that is that we have a dearth of primary care physicians.
Right.
And how is St. Mary's, how are other institutions preparing for that shift in the delivery of health care to primary care, which is more efficacious as opposed to emergency room?
Well, I think that's a good question, Brad, because at St. Mary we have a UCLA Harbor affiliated residency program for internal medicine.
Fantastic.
And that's been there for about 44 years, and we graduated about 15 primary care physicians into our community. So that's how some of the hospitals and St. Mary's are trying to provide that supply of doctors, especially in primary care, that's necessary.
At the same time, we need to change the way people think about receiving health care.
Right.
I mean, if for 45 years you've been going to an ER doctor when you have a flu, you know, what is it, old habits die hard?
Yes.
What is St. Mary's, or what is the medical establishment doing to reframe how people should think that they're going to receive medical care?
Well, I think that's a good point, Brad, and I think that comes down to providing those outpatient services that are necessary, especially in the primary care area. For example, we have 4 clinics on our campus for pediatrics, for family practice, and for other services, and those clinics allow patients to receive primary care instead of going to our emergency room. And that's the reason also we have a mobile clinic as well.
Right.
So we take care of those primary needs. So the ER isn't used for primary care, but used for trauma care and care that's required in an emergency room.
Another challenge for medical institutions is under the law, you are required to provide medical care regardless of insurance status.
Absolutely.
That presents fiscal challenges, financial challenges. But the hope, we'll see if it happens with the Affordable Care Act, is that for the neediest amongst us, that if a state decides to, there will be an expansion of Medicaid, or in California, Medi-Cal.
Absolutely.
That presents a lot of exciting fiscal opportunities for a medical institution, but at the same time, it can be a morass of paperwork. Again, changing the way of thinking. How are you preparing for that?
Well, you know, with the fact that Long Beach and the country, Long Beach has about 102,000 individuals that are non-insured, and many of them can be eligible for the new Medi-Cal expansion, which is anyone that's making less than 138% of the federal poverty level. That in itself is an opportunity to educate those in our community, and we're going to do that with ambassadors, we call them ambassadors, to educate those patients as to their benefits that they would have under the expanded Medicaid or Medi-Cal program.
What's so frustrating for so many medical professionals is that California continues to cut Medicaid reimbursement. To the point that many medical professionals are not accepting Medicaid anymore. Another 10% has been cut recently. What do you do?
Well, that's a challenge, and that's all the more reason why we're looking for more efficient ways to treat those patients instead of an expensive emergency room. So what we do is really focusing and educating them, the community, as to the right level of care they should seek versus an emergency and primary care. And we're doing that, like I said, through a number of programs. We're outreaching. We're also providing a Stanford University model called chronic disease management. And we teach patients that have diabetes and heart failure how to take care of themselves at home, so we can maintain that care and that level of well-being at their homes instead of ending up in the emergency room.
I have to ask you about another model that seems to be getting some traction. A couple of years ago, I woke up 2 in the morning. The pain in my ear was so dramatic, I didn't know what to do. I thought my ear was exploding. And I said to myself, I don't want to go to an ER. I can't go to a primary care physician. I found an urgent care facility. It was so effective for me. I got in, I got out. The bill was much less than it would have been if I had gone to an ER. Is urgent care going to be the next great expansion in
Yes, you're seeing. You're not only seeing that hospitals pursuing that, but also you see that Walgreens and other companies are actually getting into urgent care type medicine. So you're going to see a lot more urgent care going forward. Again, going back to your original point, Brad, of making the ER what it's for, and what it is for is that's for trauma cases.
What about St. Mary's? Are you looking at urgent care?
We're looking at that as a strategy as well.
Let's talk about what we know as the exchanges. Part of the way that the federal government hopes to pay for healthcare reform is through economies of scale. In order to do that, you need more people in the insurance pool. And so states have the option to create what's known as healthcare exchanges, where individuals can be part of a pool. They'll have more buying power because they're part of a pool, and presumably their insurance rates will come down. Some states are not doing it, so the feds have to step in. California is. We have what's known as Covered California. October 1st to March 31st, that's the period whereby people can sign up for the exchanges. Do you think anyone really understands what I just said?
Well, it's a complex issue and a subject, and that's why hospitals, community leaders, health departments are really providing, and same with the federal government, are providing those outreach, educational type of programs. That
it's fascinating. I don't know if you heard this. I read this recently that Covered California, the exchange, has an advertising budget. Fine. They have engaged in deals with TV studios for product placements in TV scripts. So in the show, for example, Modern Family, which is a popular show on ABC, Covered California is being written to the script as a way to get the message out.
Exactly, and the message is that this is an opportunity for those that don't have insurance, that have an opportunity to select among 13 different health plans. And also there's a level of a difference in some of the price levels from the platinum all the way to the bronze, and it allows people to determine what kind of care they want to have or have covered for. So I think it's a lot of choice in the Covered California.
Do you feel as if that here we are in Southern California, where it's a melting pot of so many different languages? Is the message getting out to the communities of color or communities of foreign language, whatever term you want to use, about exchanges, Medicaid expansion, that there are new choices, new solutions?
Well, I know we are doing that at St. Mary's. We're reaching out to we have a large Cambodian community, Hispanic community, and African American community. So we're doing that through many of the programs that we have existed for many, many years, and reaching out to them.
As I understand it, the undocumented are not eligible to participate in the Affordable Care Act.
That's how I understand it.
Politics aside. Now what?
Well,
with St. Mary's, you still have to cover.
You're still going to, we're still going to take care of those that come across our doors. That's been our healing ministry for 90 years.
Oh, it's also your particular. I mean, as part of a nonprofit mission.
Exactly, and we're committed to that.
But does that present challenges?
It does. Obviously, it does. But hopefully, with what's going on in Congress in a couple of years, maybe that will be addressed as well.
Right, in terms of immigration reform. I mean, it all literally loops together.
It does loop together.
Tom, I want to thank you for joining us. Thank you for keeping the individuals of Long Beach happy, healthy, and safe. When we come back, we'll be speaking with Kirk Davis. He is a member of the Long Beach Lions. That organization is looking to defeat blindness. My name is Brad Pomerance. This is Charter California Edition. Welcome back to Charter California Edition. I'm Brad Pomerance. Our guest is Kirk Davis. He is the president of the Long Beach Lions Club, which is what?
It's a service organization that's been in the city since 1921.
And it really has a tremendous history filled with pomp and circumstance. Give us a sense of what the Lions were doing back in the early 20th century.
Well, they're doing a lot of interesting things because actually after the club was formed in 1921, they had the earthquake in Long Beach.
Oh my.
They went out and found different donations to give to the people that were in the area.
But even before Long Beach chartered, and I know Long Beach was one of the earliest clubs to have chartered, the Lions became affiliated with a very well-known American figure. Why don't you tell us about her?
Yeah, well, in 1925, Helen Keller came to the Lions Club International Convention and asked the Lions to be Knights for Sight. So actually they gave the Lions Club a mission to help out with blindness and all the things that are affiliated with it.
And for those that are familiar with the Lions, that is really what's become synonymous with the Lions, which is trying to combat blindness. And that's been its history, its mission, its goal, its desire for almost 100 years.
Yes.
Interestingly, the man before me has faced the issue of sight and blindness. I want to get a sense about how you became involved with the fight to defeat blindness.
Well, back in 1991, my son was born, and he was born with congenital cataracts.
And if I may interrupt, you had a sense that that was possible because his mother's side of the family had several generations of those born with congenital cataracts.
Several generations, I think up to 6 generations
Wow.
born. When my daughter Emily was born in 1993, she also had congenital cataracts.
And it's interesting, your first child, Alyssa, she was not born with it, so you thought maybe you had broken the cycle.
Yes, exactly.
But Jake and Emily did have that congenital cataract.
Yes.
And you were in a very challenging situation.
Yes, I didn't really have a great job. I really didn't have health insurance.
Oh my.
And I had a friend of mine, a really good friend of mine, his father, Gene Johnson, was a member of the Lions Club. I went to Gene and I asked him, what do the Lions do? He told me what the Lions do, and I told him, my 2 youngest children were born with congenital cataracts. Is there anything you can do to help us? And he said, yes. And so the Downtown Long Beach Lions Club sponsored both of my children, made sure they had cataract surgeries, and took care of all their eye care for a number of years. And now all 3 of them are very, well, my oldest daughter who didn't have cataracts, she has a really good job and is committed to what she's doing. My son Jake is going to Long Beach City College and is doing well. And my youngest daughter Emily is going to Northwestern College. She went there first on a volleyball scholarship. And now
volleyball?
Yes,
so
volleyball.
A little girl who could barely see when she was born became a volleyball star.
Yeah, we have pictures of her at her first birthday holding things up to her face because she really couldn't see them. And we would show those pictures of people and they couldn't believe it.
And she's studying to be a nurse.
Yes.
And you think about what's necessary to be a medical professional, the precise sight that you need. And she has it. I mean, she has glasses, whatever, but that's okay.
Yeah.
So you personally know how the Lions can impact someone's life, a family's life. And you and your now wife, if I may say, have become incredibly committed to the Lions.
Yes, we've both been members for 5 years. So, I mean, it's a very humbling experience to know I could have this group of people elect me to be their president in such a short time. And like I say, it's great to be able to go out in the community and help. My wife, Hilda, is the chairman of our Community Service and Awareness Committee, which was reformed 3 years ago. And since that's happened, we have been participating as much as we can in community events.
And I know that you had been working or continue to work with the Long Beach Department of Health and Human Services on glucose screenings, on cholesterol screenings. You've been working with the West Coast University School of Nursing on health screenings. But you've come back to your roots. And coming up on October 5th, the Long Beach Lions will have its Sight First Health Fair.
Yes.
I want to hear all about it.
All right. We're going to have our inaugural health fair called the Sight First Health Fair. It's going to be held at Thomas and Edison Elementary School in downtown Long Beach. We have a lot of services we're going to be able to give out that day. One of the biggest things we want to be able to do is for children, be able to refer them for eye exams and glasses, which is really one of the big missions of our club. because we have a program where we try to give any child in need in the Long Beach Unified School District eye exams and glasses to help them in school.
And it really is stunning how many children slip through the cracks when you look at vision. They can be in a large classroom, there's just not a sense that they're having difficulty, and it will impact learning in such a dramatic way. And the more that learning is impacted negatively, it's often hard to get that back.
Yeah, what happens with vision is when you lose your vision or have an eye disease, sometimes it doesn't have any pain. So people don't realize that something could be happening to them.
Although my daughter has some minor vision issues, nothing significant, but one of the symptoms can be headaches.
Oh yeah.
And so I urge you, if your children are talking about getting headaches, it could be their vision.
Yeah, and another thing too is that if you realize you're not seeing better, a lot of kids might just move closer to be closer to the chalkboard, closer to where the action's going on in the classroom.
If they start getting close to the chalkboard, close to the television, they are telling you something. I mean, your daughter,
exactly.
I mean, holding your presents like this, that was a clear signal something was going on. Okay, so you're offering referrals for children for glasses, but there's so much more that you're offering.
Yes, we're going to do glucose examinations because diabetes directly affects vision.
Be specific. I mean, it is really dramatic what diabetes can do to vision.
Where we'll be testing for cholesterol.
But let me just back up. I mean, you can go blind.
Oh, yes.
If you have diabetes.
Oh, yes.
There's no question about it.
No question.
It wreaks havoc
yes.
on vision.
Oh, of course.
And so, and you could have type 2 diabetes, which is adult onset, not even realize it, and before you know it, your vision has flown south.
Yes, we can do. We can check for glaucoma.
Right, glaucoma. Right.
Yes. So
and cataracts.
Oh, definitely.
I mean, clearly, as one gets older, you can start seeing the cloudiness in the eye. And what's stunning to me, my mother had cataract surgery. Not a big deal, and how remarkable the turnaround can be once you have the cataracts removed. I mean, look at your children.
Oh, yeah, for sure.
Okay, so there's vision screening, cholesterol screening, glucose screening. How about hearing screening?
We can do hearing.
Right.
We're not sure right now if we're going to offer it.
Okay.
But our West Coast University School of Nursing, they're being trained in public health.
Right.
When we bring our iMobile to an event, we do have a hearing booth on the iMobile that can offer hearing screenings. But like I say, there's still some details we're working out.
Yeah, by the time this airs, it may be that it's already been resolved. Also, you're looking at the question of healthcare reform.
Yes.
The Affordable Care Act is before us, and I think there's a lot of questions and confusion about the Affordable Care Act. You're going to have some information about that?
Yes. Our health fair is on October 5th, and October 1st is when the sign-ups start in the state of California.
That's correct, and there's no question that folks that may be eligible for either the healthcare exchanges through Covered California or through the Medicaid expansion, October 1st is the day to look to see if you shall qualify.
Right.
The good news is there is open enrollment through March 31st, but be that as it may, you don't want to lose that opportunity. I don't remember, is vision care covered under the Affordable Care Act? Do you know?
That, I'm not sure about that.
I'm not sure either. We're going to have to find that out because it is a very important question. What's also nice about your event is it's a family affair.
Yes.
So you're going to have a children's corner, you're going to have face painting, crafts, lots to do. How can we help? How can we get involved?
Well, the best thing to do is to come to support the event.
Perfect.
Come and meet the Lions and the people that are working there. If you're interested in making any kind of donations or joining the club, we will have information there that can put you in that direction.
The website for the Lions Club is simple. It's lionsclub.org. Is there a specific website for Long Beach, or you can get to it through the main Lions website?
We'll be able to provide that at the health fair, and people will be able to get that information.
Okay, so I want to remind everyone, the Sight First Health Fair, sponsored by the Long Beach Lions Club, is held on October 5th. It will be held at Thomas Edison Elementary, which is on Main Avenue in Long Beach if you live in the Southern California area. It will be held from 10 a.m. to 2 p.m. If you want more information, you can go to the Lions Club website at lionsclub.org. I want to thank Kirk Davis, the Lions Club president in Long Beach. I'm Brad Pomerance. Thank you for watching Charter California Edition.